So today is a very important day. We're launching the COVID vaccination programme and our flu vaccination programme for staff across Cork and Kerry community. It's very important for staff who work in healthcare to get their vaccinations because they are dealing with patients. They have their home life, so it's important that people are safe in their workplace and at home. I think when we look at the number of COVID cases that are rising at the moment, it's very important for staff to get their vaccinations early. And we've all dealt with patients or family members that have had COVID, and we've seen how difficult it is to manage through COVID when it does happen.
We're facing into another winter, as you're aware. Flu and COVID have not gone away. We're going to be facing increasing cases of COVID and flu throughout this season, and I think it's important that even though you may have had flu vaccine last year, or you may have had the infection itself, or you may have had COVID, it's important that you're now again vaccinated and that you attend your local clinic to get it.
Today we're launching the winter vaccines campaign, and I suppose our goal is to maximise the uptake of vaccines to protect ourselves, our families, and most particularly our vulnerable patients and clients from getting either COVID or flu this winter. So we do expect COVID and flu to be circulating later on this winter, and we want to make sure that our staff, our residents, our families and the community at large is as protected as we can be from serious infection. I get the vaccine to protect myself, my family, my friends, my loved ones, my work colleagues, and most particularly I think we really have a responsibility to protect the vulnerable people that are attending our services and that depend on us day to day for their care in many different settings.
So our plan really is to promote vaccines to healthcare workers to help them protect their clients, their services, their families at home, and really to get the message across that it's so important for all our healthcare workers to have both COVID and flu vaccines this year. It's very safe to have both together, and we're running a huge amount of clinics across Cork and Kerry, so there should be a clinic coming close to where you work or in your workplace where you can avail of your vaccines. As healthcare workers, it's incumbent on us to protect the people that we look after, both within our services, our colleagues, and the very vulnerable patients that we all look after. So it's really important that we all get our vaccine. We can carry viruses and be totally asymptomatic and then pass them on to vulnerable people who can become very sick with them. It's also very important for any of us who have children to ensure that our children are vaccinated because they can really spread disease again to vulnerable populations. So we want to increase uptake and promote herd immunity.
So we're here today to encourage all staff in Cork and Kerry to protect and not infect and to take their flu vaccine. So it's really important that we get our winter vaccines to protect ourselves, to protect our families and to protect those that we work with.
In Catching Stories, we interviewed people about their personal experiences, family experiences, community experiences of infectious disease in Ireland throughout the 20th century and into the 21st century. So we've brought these stories together in a resource, catchingstories.org, and it gives us another kind of insight into what it was to live in a time when there was no vaccination against measles, for example.
The fundamental idea of the project was that I'm hugely motivated in the space of encouraging vaccination and how to bring awareness of how effective vaccines are and how important it is that as many people as possible get vaccinated against diseases in order to ensure herd immunity. So one of the ways in which we started to explore that was by bringing out the stories that people have regarding historical diseases such as polio, TB, ones that have always had a very high morbidity and mortality rate associated with them, but now, due to the power of vaccination, are decreasing or indeed in some cases have been eradicated.